Hello, and welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau. And today I'm here with Dr. Robert Kerstein. Hi, Robert, welcome.
How are you today, Vanessa?
I'm doing awesome. How about you?
Good, very good.
Oh, I'm really excited to talk about this topic today. I think it's a very important topic. We will be discussing digital occlusal technology in daily dental practice. And Dr. Kerstein is really an expert in this area in dentistry. He's recognized as a leading author and a researcher in the field of computerized occlusal analysis. He has lectured around the world. He's provided live patient treatment seminars in many hospitals, dental clinics, and educational facilities for many years now. How long have you been in dentistry, Robert?
I became a dentist in 1983, and I became a prosthetist in 1985. So
you're gonna make me do the math. 30 some years, right? 35, so 36 years. So that's some years of experience. And how long have you been involved with digital occlusal technology?
Since 1984, when the original T-scan technology was built.
Wow. So what's that, 36 years?
36.
Yeah. 36 years. Okay, so that's some years of experience. So let's dive into this. Can you start us out by helping the event planners who'll be watching this, help us know what is the problem or the challenge? What's happening at the dentist end? What keeps that dentist up at night that you're going to solve with this course? What happens in their practice or with their patients?
Well, the most common thing that keeps them up at night is post-insertion occlusal difficulties, which are where a patient gets some new teeth made and they come back a number of times and they can't get the bite right, and the patient is, adapting but struggling, and it often takes many visits, and sometimes it deteriorates into full-blown TMJ. So it's a common problem. It's actually the most common problem I saw over the years of treating occlusal problems with the T-scan technology. That was the most common thing that came into my office. I had a few crowns made a few weeks ago, and a few months ago, a few years ago, and I went back many times to the dentist, and they kept grinding on my teeth, and my bite never felt right, and now I have headaches and jaw pain. And so it's a very common non-answerable problem for the non-digital occlusionist. It really requires technology to be able to manage. And when you have technology, it becomes actually a very simple thing to resolve.
And we definitely have technology, right? So tell us more about your course and how does digital occlusal technology solve this problem?
Well, the course itself teaches dentists who attend about the value and benefits of measuring the occlusion, which is very different than using non-digital occlusal indicators like articulating paper. They mark the teeth, but they really don't measure any forces or timing. So the course illustrates how to use time-based pressure mapping to treat problem contacts on teeth, and simplifies managing these kinds of complications very readily. The patients who came to see me were amazed that I could often resolve a problem they had for many years in 1 to 2 appointments, just being able to measure their occlusion. So the course teaches general principles of how to measure someone's occlusion, and then the applications that occur in daily practice, which one can be post-insertion complications, others can be loose and mobile teeth, sore teeth, receding gums, painful and sensitive teeth, cold-sensitive teeth, TMJ problems, implant complications. There are a lot of bite-related complications that the T-scan solves for the dentist. And so the course illustrates many of those applications.
And I'm sure you provide mentoring on this and work with dentists one-on-one. I know I've seen on your website there's just dozens and dozens of testimonials of doctors that have used this and have found really good results. So I was really impressed by that. But tell us more about the presentations. If I as a meeting planner wanted to bring you in to speak on this, do you have multiple levels of learning? In other words, like for the people who are brand new, or what if we're already using T-scan in our practice? Tell us more about the scope of your programs.
Well, that's a very good question. There is a variety of levels of learning, which is a good term that you used, and it involves first exposure and understanding there is available technology to measure occlusal forces and timing and pressure, which is often dentists are unaware of that. And, so that's one level, exposing them to what it is and how it works and why it's so helpful. And then when someone gets involved, then the learning becomes, more like training, which can be online training, for example, on Zoom or Skype. It can be in-office training where the dentist actually has patients with me chairside and we work together and I mentor them on how to use the technology to deal with a common dental problem, like a post-insertion, multiple visit returning patient, or a bridge that keeps coming loose, an implant case that keeps breaking. Those are all things that a dentist can learn chairside. And then, of course, there's a lecture series as well, which can be targeted to any discipline in dentistry where occlusion applies. For example, there are lectures in aesthetic dentistry, there are lectures in implant dentistry that relates to, there are lectures in general occlusal diagnosis and patient education. So there's a lot of ways the T-scan can benefit a dentist who is able to include technology in their armamentarium.
Yeah, so it sounds like you can gear this towards all types of different audiences and depending on where they're at with their skill or their area of specialty.
Yes.
Is this typically for dentists only? Do you include dentists in clinical team, or like who would your typical attendee be?
Well, certainly the dentist would be the primary attendee, but many practices train their staff members to do T-scan data gathering as part of their diagnosis. So in the same way, a hygienist might take radiographs at the time of a prophylaxis visit, a hygienist or an assistant can be taught to take T-scan data to do occlusal analysis at a recall visit or as a new patient intake data set. And so many of the programs apply to the staff, especially the training programs, the hands-on programs and the in-office programs. The staff really benefits from those. The lecture programs, they benefit from seeing the value of having technology used on patients that they see come in. The staff is right there when the dentist has Mrs. Smith return for the 6th or 7th time. The staff knows this patient. They've seen her come in. They're really hoping that this will be her last visit. So they can certainly relate to the topic. So the whole team can benefit from courses on the T-scan.
Oh, awesome. And then let's talk a little bit about the format of the presentations. In a day and age where virtual has become more common, or also virtual hybrid meetings where we could do like maybe some virtual attendance while people are here at physically in the room, or just straight on plain traditional meetings where everybody's in the room. And there's all these different formats now. Tell us about, are your courses able to flex and be available for all of those situations, virtual and live?
Absolutely. It can be lectured in person, can be lectured online, can be given as a series of lectures to a group who has an interest in taking more than one level of education. So, the only part of the content that wouldn't translate to almost total virtual learning would be any of the hands-on in-office training mentoring scenarios. And of course, that's certainly something that can be sort of pre-trained with virtual learning, like having a Skype session or a Zoom session to see where the office is with the technology and bring them up to speed and then go to their office. So other than the actual mentoring sessions, any of the lectures and courses can be given virtually.
Excellent. Well, is there anything I haven't asked you that you feel would be important for the meeting planner to know about your presentations that we haven't already talked about?
Yes, I think it's really important that the meeting planners understand that digital occlusion is a major advance in the practice of dentistry. And it has answers for many common daily occlusal problems that dentists face, that traditional occlusion that has been used non-digitally with marking paper and dental articulators. These methods do not have the solutions, scientifically based solutions for these common daily problems that measured occlusion, digital occlusion offers the dentist. And therefore it offers many improvements to patient care. So the dentist has a faster time dealing with occlusal problems, has more predictable outcomes, and the patients, of course, have much more comfortable bites and don't return for many, many visits complaining that their bite isn't right after they just got their new implants installed or their new smile design done. And so it's important that the meeting planners understand that digital occlusion is a new avenue for the dentist to improve their services to their patients. And this is something that they may not be aware of, meeting planners.
Yeah. And then ultimately we have better care for our patients and happier patients, and it's just a win-win for everyone.
Well, that's it. The patients deserve the highest quality of care, and measuring their bite really raises that care to very high tolerances. Digital technology is amazing what it can really do for patients, and we're seeing it in many aspects of dentistry, of course. So digital occlusion is really a direct patient improvement because almost every procedure we do involves the occlusion.
Well, it makes total sense to me. Do you have any parting thoughts on this subject, or do we pretty much cover it before we sign off?
Just that I'd be honored to present at any meeting that a meeting planner felt the topic would be of value for their attendees. I certainly can tailor the content to fit a specific group, as I said, like an aesthetic group or an implant group or various occlusal philosophy. The T-scan crosses all occlusal philosophies because it's really a measurement tool. And so it fits into everyone's occlusal belief system just with knowledge of data and hard numbers and really precise outcomes. So I would be very honored to participate in meetings that people felt the content would be important.
Awesome, awesome, awesome. Well, for the event planner who would like to find out more about working with Dr. Kerstein, visit dentalspeakersbureau.com. You can find him there under, you can search Kerstein, Kerstein, or you can reach out to I should know your website. It's Dr. Robert Kerstein, right? drrobertkerstein.com would be a direct link there. You can shoot off an email to me, info@dentalspeakersbureau.com, or what's the best email for you, Robert?
It's a little complicated. tmjdoc@ix.netcom.com.
That's an old Earthlink email, right?
Yes.
ix.netcom.com. So tmjdoc, tmjdoc@ix.netcom.com.
Yeah.
Got it. Very good. So thanks again for being here, Robert. It's always a pleasure. And thank you to the event planner for watching, and feel free to reach out if we can help you with anything. I know Dr. Kerstein would love to have a chance to chat with you and be able to help you with your next event. So until next time, be well, and we'll see you soon on The Buzz. Bye-bye.